Hello guys, hello. I am up, I am dressed. I'm really dressed, I'm real life dressed. Anyway, I'm only dressed like this because Saint had pictures today. We had the Life 365 come out to the house and they took portraits of him and everybody else in the house, which was amazing. I won't see those pictures until the 4th. Yeah, the 4th. I'll see the pictures on the 4th. But anyway, I said I was going to start my vlog 7 days, so I do have something halfway recorded. I don't understand why he put his head in the joint all extra like that, but anyway. 7 days before Saint's surgery. I'm not even sure if I posted or made a video, but anyway, Saint's surgery, thorax surgery is on April 1st, which is next Friday. So I just want to vlog this whole situation and, you know, maybe be some type of help for somebody else, because I'm sorry, somebody called on my phone, that's why I'm looking at the phone all crazy. Maybe to help someone else who may be, you know, feeling how I'm feeling right now, and you know, they don't have anybody to talk to, they don't have anybody to vent to, you know what to expect, because going into this situation for myself, I don't know what to expect. I don't know what's going to happen. Like, yeah, they prepped me on a little bit of stuff, but as a mom, you know, I'm emotional. Like, I'm really emotional. Like, some of my friends may think I'm not, but I'm a really emotional person, and you know, this situation is really hard for me to, you know, understand and come to grips to understanding what's going on. And I know that I have to have faith in the higher power and know that he's gonna be okay. But in the same sentence and in the same token, you know, it's the whole thing of it's no longer in my control. You know, as a parent, you control majority of everything that your kids do. You know, if something happens to them, you can try to protect them and shield them. In this instance, I can't do anything. I just have to give my son up. So, anyway, I know that Saint's a fighter because, like I said, that first video, not the first video, but some videos ago, you know, the doctors counted my baby out. And he's been strong. He's been a great little boy. He's been great. I can't say anything different about it. But anyway, we'll be doing a 7-day situation. I probably won't be talking every day on this video, and I'll probably break it into pieces of pictures and photos and videos of him or whatever, because I haven't really showed you guys anything of Saint besides, I mean, I didn't even tell you guys his name besides right now. Pictures and videos and stuff. Again, I'm going to keep on trying to vlog while we're in the hospital. I don't know if my mental will be able to do that. I don't know, but I'm hoping that I'll be strong enough to be able to help you guys and answer questions for any parents out there that is going through something that I'm going through right now. Okay, let's see. Saint still goes.
Red light, camera ahead.
Saint still goes to all his cardiology appointments. He's there every 2 weeks. He doesn't see the Down syndrome specialist until, Jesus, I want to say in April. He's seen a neurologist. He's gotten an MRI. He did get that. He does have Dandy Walker malformation, which is pretty much, I want to say, I'm not too sure about this, guys. I don't know too much about it. But it can lead to hydrocephalus. Luckily, he does not have any hydrocephalus. He has no fluid on his brain, which is a blessing. Thanks. Again, hopefully after he does this cardiac surgery, he will not have to take the latex anymore, which is his heart medicine to keep the fluid off his lungs and stuff. So he has to take that every day. Let's see, what else? We do have physical therapy. He does have a physical therapist that comes out. I know it sounds so weird because Saint is only 9 weeks old, but he has a physical therapist that comes out, and you know, right now all his skills that he needs to learn is just pretty much tummy time and grasping. He does that, so he grasps. He doesn't really like tummy time too often, but that's something that we're working on with him. Let's see, what else is going on with Saint? I think that's it. He's not in the car with me, guys. He's with Dad right now because he's not doing the prep of his surgery, which I was informed that for 7 days he has to use that stinking ass Dial antibacterial soap. That soap smells so fucking horrible. I hate that soap with a passion. He has to use that every day. He has some ointment. I cannot think of the name of it right now, but it starts with the M. I know I have it for my eczema on my hands and stuff, but we have to swab that in his nostrils twice a day, and that is going to help with him not getting staph infection when he goes into surgery. Yeah, so right now that's what we have to do for these next 7 days until next Friday. So that's it. I've looked over the surgical paperwork. I haven't really looked at it, but I've looked at some of it to know when he has to stop eating. Like I said, his formula is, his calorie intake has been increased due to he's not gaining that much weight. He's not gaining as much weight as they would like for him to gain, but he's gaining weight. I don't want you guys to be alarmed, but that's it. I mean, yeah, so these 10 weeks have been, you know, a whirlwind. I say 10 weeks because I was out of work a week prior to me having Saint. So these 10 weeks have been a whirlwind, to say the least. I'm just grateful. I'm grateful for the prayers, the well wishes, not only from my friends, my family, the community that I serve as a mail carrier, Facebook, Instagram, YouTube friends. You know, I appreciate all the kind words that people send through my DMs. I appreciate it. I can't say that I don't, because again, all the kind words, I really appreciate hearing them, because, you know, right now I don't really, you know, this situation here, it really,
at the next light, turn left.
It really tests your strength. It really does. It really does test your strength. And I'm not one, when things are not in my control, I don't like it. It's not a good feeling for me. Like, I'll find so many reasons why I need to let my aggression out, and my aggression is by taking it out on whomever or whatever is near me. And I know that's so wrong, but that's just how I deal.
At the light, turn left onto North York Road.
That's how I deal with things. But I'm gonna get off of here because my GPS is being so trifling right now. It's being so trifling. All right, guys, it is Wednesday. It's Wednesday. I look like shit. I feel like shit. I feel horrible. I feel like a lot of things. Friday is approaching. It's really approaching. I look like shit. I don't care. But Friday is approaching. So Saint will be having his surgery on Friday. I'm just a ball of emotions. I done cried a lot. I done cried a lot. I'm gonna cry some more. I know I am. Like, this week has been like a whirlwind. I can say that because it went by really fast. This week went by really fast. Really fast. I can't even imagine what my son is about to go through, because I wish that I can take it from him. I wish that I could, you know, be the person getting the surgery. I wish I can give him my heart. I wish I can do all the things that I can't do. This situation has really tested me. It tested me. It showed me that I'm not as strong as I thought I was, or as strong as I proclaim myself to be. Because this situation right here has really, I don't know, it's just a lot to take in. And I mean, I know I've made a lot of videos where I said he has to have a surgery, and that's something that has to be done, but I wasn't prepared for that, something to have to be done so soon. Like, Saint is 10 weeks old. He's 10 weeks. That's all. He's not 6 months. He's not 1. He's not 2, and maybe, I know I probably would feel the same way at that point, but it's like right now, I mean, I just got a chance to just hold him after, all the doctors doubted him from 15 weeks on that, he was going to be this and he was going to do that, and, you should terminate the pregnancy, this, that, and the third, and, him being in the NICU for 3 days and me not being able to see him after I had him, all those things, I just feel like I haven't bonded enough with my son for me to have to give him to a doctor or a surgeon. All right, so like I was saying, washing him is really hard. Unfortunately, in this Ronald McDonald house, you can't have people come upstairs with you. They're not allowed to come inside the building, actually, if they're not registered guests. So initially, my aunt was going to help me with bathing him, because I didn't know. I thought it was okay, you just got to wipe him off with this stuff. No, it was really in detail, and as you can see, it's not that big. I mean, it's a big room, but it's also not spacious enough where you can actually hold the baby and wash him and do all those things. And again, not a baby at his size. So that was a tad bit hard to do. So that was hard. Like I said, I'm trying to keep my mind occupied on other things, because babies, they feel when you're upset. They sense that type of stuff. So I'm trying to keep my mind occupied. Yeah, I'm just trying to keep my mind occupied and keep myself doing stuff. So keeping myself busy. I'm trying to clean out his bottles. I only brought 2 bottles with me, but this is a little one. I intended for this to be for the breast milk this morning, but I wound up just using a bigger bottle because I wanted to make sure I was stockpile feeding him. I wanted to make sure he was full. Even if he didn't want to eat, I was still not forcing him, but I was offering him the bottle. And as long as he was accepting it, I was going to give it to him. So he accepted the bottle every time I gave it to him. So he should be good for it. I am leaving here probably I'm probably gonna leave this room at maybe 5:30-ish, just so I can go sit in my car, get myself together, listen to my gospel music, say a couple of prayers, all those things. So that one, my mind is a little at ease. But yesterday was really hard. It was, I thank God that I had my family members here to help me with that process, because again, same as 10 weeks. I knew he had to get some things done before having surgery today. I just wasn't prepared for how much stuff he needed to get done. Of course, he had to get his EKG, echocardiogram, 2 ultrasounds, one of his head, one of his kidneys, an x-ray of his chest, a COVID test, a MRSA test, and he had to get blood screening, of course, for the blood transfusion, blood count, some typical blood things. But with the blood, first of all, when we got here, I was by myself. My aunt didn't get here yet. My cousin didn't get here yet. So I went into how they normally do a cardiology. Is you go into this little office and you take his weight, his blood pressure and do his little EKG. Yeah, no, that wasn't the case yesterday. They pretty much shoved this, the COVID test in my son's nose. They actually went really far back, and that set me off because I don't really like to see my baby in pain. No parent wants to see their baby in pain, so that upset me. So we had to calm him down from there, which was fine after he got himself back together. I wasn't together at that point. Then after that, we had to skedaddle over to. Sorry, I was trying to figure out who was on the door. We had to skedaddle over to lab. So like I said, I wasn't aware of him needing a blood transfusion because I would much rather me or dad donate the blood to him because, we're here. I'm not saying I have anything against anybody else because I've had to have blood transfusions with miscarriage before. So I don't have anything against getting anybody's blood, but if you can get family members' blood, why not get it? So I was a little upset that they didn't say that to me so that way we could have did the proper testing that, prepared for this situation so that way they could have the blood on standby. But whatever. We get to the lab and the young lady says he has to give blood work. And I'm like, okay, fine. She was like, but I have to stick him twice. And I'm like, excuse me? She was like, yeah, one of the tests, you can't take the blood from the same arm that you already drawn from. So I'm just like, okay, what the fuck? I was okay with her trying to find his veins. So she got the first one, and I was getting a little irritated because it was like she didn't know how much blood needed to go in every tube. And that kind of upset me. I mean, at this point, everything kind of upsets me. Like, I'm on 10, even when I probably shouldn't be. But I was getting a little upset behind it, so I was ready to smack the shit out of her. Then the girl comes over with the nose swab. And I'm like, what is the nose swab for? Oh, it's for MRSA. And I'm like, listen, I ain't saying nothing about no fucking MRSA. So you're not going to keep sticking shit up my baby fucking nose. So at this point, I'm getting very upset. And now I want to fight people because I can't hold my emotions in because I'm about to take my baby and move on because it's not like the first blood draw was relatively fast. No, they had to actually use a little syringe to pull the blood out. So, my aunt took him and they told me I had to, leave out of the laboratory, which was fine. I didn't really care because if I stayed in there, I'm going to beat them up. After that, we had to go get his x-rays. Checked the x-rays, which was, the easy part of this whole day. After that, he had to go back and get his echocardiogram, which is them just looking at his heart, taking the pictures, making sure everything that they've seen thus far is pretty much the same. Nothing has deviated, nothing has changed, just in case they need to change anything. I had to talk to the surgeon again. He's the chief surgeon over here. I'll just keep my opinions to myself. He's the chief surgeon, and we sat and talked with him. The surgery should take 3 hours, which is probably going to be the longest 3 hours of my life, the longest 3 hours. So he goes in for surgery at 8, so I'm thinking maybe 12:30. He should be done, and that's with me given the time that it takes for them to sedate him and do all those things. So I'm thinking 12:30, he should be done. In my mind, because in my mind I'm trying to figure out a way how the hell I'm gonna get back there and sneak back there to make sure my baby is okay. You guys think I'm playing, but I'm dead serious. Then after that, we went back to Imogen so he can get his ultrasound, which was of the top of his head, the little soft spot, and then of his kidneys. The lady said for some reason when kids are getting heart surgery, they want to check the kidneys and the heart. Kidneys and head. So we did that, and then our day was done, and our day started at 8:45 yesterday morning. So yeah, we didn't get done everything until maybe 3. I had to check into the Ronald McDonald house. I had to do a tour here. That was a while. So I'm working on like maybe hourly these past 2 days. So I have my crack. I'll probably go refill my cup of crack before I leave, just to keep myself up. But this is really hard. It's really hard. It's really hard. I'm trying to, again, keep my mind off of being upset or crying or wondering why. Because, again, the Lord doesn't make any mistakes, and that's the part that I have to keep remembering. So I'm trying to remember that this is probably my test that I have to go through, learning patience and learning that everything doesn't, I'm not the dictator of everything that, comes into my life. I may dictate my being as far as, me, but I don't have complete control over everything else that happens around me or with my kids. So I think that's probably my test. So I'm trying to keep myself together. Like I said, I'm going to leave here probably at like 6-ish just to get across the street to the hospital. The hospital's right across the street, but just so I can mellow out, listen to my music, just get myself together. But I'll be back once he is out of surgery so that way you guys can know what's going on. I don't know if I'm going to record him once he gets out of surgery. I'm not too sure. I'm not too sure yet. But I appreciate everybody for the thoughts, the prayers, the comments, the messages on Instagram, Facebook. I appreciate them all. I appreciate them all from the bottom of my heart. And I know that he appreciates them as well. So you guys have been here for the journey since I was pregnant. So this is the final chapter of making sure that Saint is okay. So that's how we're going to look at this. And I'll see you guys later. Bye. Good morning, guys. It is Friday, April 1st, and there is Mr. Saint waiting to get ready for surgery. He's already dressed. He's already took his bath. But while we're here, we'll just do a tour of my room that, Ronald McDonald House was gracious enough to allow us to stay in. So, of course, this is their bed. But this one's a tad bit messy, guys, because I was washing Saint up with this. But it's great. This is Saint's. Before he has his surgery, he can have clear liquids or Pedialyte, I'm sorry, up until 7 a.m. this morning. He has the surgery at 8, so he can have this now in between 7. That's mine. That's for me. They have a welcome book. Just telling the different things here. I purchased this for Nylene because, of course, Nylene will be here later on. This is just my central section here that I have going on. Of course, Saint's medicine, more of his medicine. This has to go in his nose, like I said before. Why does it not go? Okay. I hate when my phone does this. But anyway, this has to go in his nose. That's why you see the Q-tips. This is just something for me to snack on. I'm trying to charge all my apparatuses. Milk, of course, because you needed milk. Here you need a badge to get in and get out all over the place. So, yeah, you have to have a badge. So, this is the badge to get in. What time is it? It is 4:52 in the morning. Yeah, I haven't slept any. But I'm trying to pack his diaper bag. This is all his instructions. As you guys can see, he is having a repair of a complete common AV canal defect. Blood transfusion papers, also pre-transfusion papers. Yeah, there's a lot of stuff that had to go on there. So that was a lot. Anyway, this is, I guess, a little sitting area. I don't know what the view is outside right now because it's 4 o'clock in the morning. Oh. That's how you do that. Okay. I don't know. What the hell? I don't think this one of them ones where you can pick it up and lift it. Some blinds you can pick them up. Oh. Yeah, no, I can't see anything out there. Let's see. Let's turn the light on. I can't see anything out there, so don't even worry about it, guys. Can't see anything. So, can't see anything, but there's a comfy chair here. This chair looks really, really comfortable. There is a full-size... There is a full-size mirror here. Disregard, I had one sock on, one sock off. Listen, at this point. Here's the chair that I said was here. Oh, it's hot. I had this on for Saint. They gave me a mini fridge because, of course, like I said, the boys would be here. So, Kyre's medicine. Saint's breast milk is in there because he was able to drink that a little longer. Of course, it's 2 beds in here, so you can see it this way a little better. 2 beds, a TV. The door, this is the closet. Here's another mirror and stuff of that nature. Here's the bathroom. We just was in here maybe like an hour ago. Here's Saint's little packet. This is everything that I had to do before he, before he gets the surgery. So this was a lot to do with the 10-week-old by yourself. So it's a lot. He had to wash with this soap that they provided, and just wash. Then after you washed them, you had to use this stuff called CHG, and they gave you this lovely timer, so you would have to flip it over, and there was a mitten that came with it that I had to wash him, his whole body. I had to put that on him, and let it sit for 3 minutes, then rinse it off. Yeah, but you had to be really anal with this, spend the extra 30 seconds cleaning the area where the surgery will happen. I had to make sure I cleaned in between his feet and his toes and all that other good stuff. I had to wash his hair. Yeah, so that was a lot that I had to do. That was a lot. So like I said, I don't really know where my mindset is right now. I don't really know. Sorry, I'm cleaning out his bottle. This is his milk bottle that I take with me when we have places to be, because I have to make his formula different than everyone else.